My friends, I'll say it again. I know these last few months have been difficult, but I will continue to listen to the science. Just earlier today, I met with our top scientists who showed me the latest data. I couldn't quite follow it all, but they assured me it suggests something terrible could potentially, one day, perhaps happen to some of you out there. It was at that point that I knew we needed to lock down the entire province as soon as possible. Does this decision go against my gut instinct? Absolutely. Does this decision feel wrong, knowing more lockdowns will result in businesses going bankrupt, families going into debt and poverty, that individuals will be pushed to the breaking point, experiencing domestic abuse, and in some cases, suicides? Yes, it feels wrong. But folks, we have to go with the science on this. Now, I believe we have a few minutes for questions, and I'll leave those to Dr. Williams.
Well, thank you, Mr. Premier. Hello, everyone.
Next question's from Eileen in Toronto.
Hi there. Toronto has already been in lockdown for 30 days, but schools stayed open all that time. Can you explain why you're only closing the schools now, after Christmas holidays?
Well, that's a good question. We really wanted to keep the children at school as long as we could to continue their in-person education. However, our study showed keeping the schools open did not send a terrifying enough message to the general public. So we needed to close the schools down to remind people how frightened they should be. But don't worry, children are very adept at using social media and will do just fine being isolated from all their friends for weeks on end during the depressing winter season. And we'll continue to monitor their progress with their various apps to ensure they continue to live a terrified existence.
Follow up?
So, just a few weeks ago, Toronto's Associate Medical Officer of Health said there was no data to suggest children were acting as quote-unquote super spreaders. Is there new data to suggest children are spreading the virus?
Yes. It's very compelling data. Frightening, even. Thank you for your question.
Next question's from Stan in Hamilton.
Oh, hey, how's it going, eh? Long-time listener of these ridiculous announcements, first-time caller. I've been listening to these announcements today, eh? And I had a thought. In Toronto, small businesses have already been closed down for over a month, eh? So we know the virus isn't spreading because of them. Yet every day we see new record high amounts of cases being reported. Do you think maybe this virus could be potentially spreading, at least in part, through like the big chain stores that have remained open?
Well, thank you for your question. And no, we don't believe the chain stores remaining open are contributing to the spread of COVID. You see, the big box corporations pay the federal government a certain amount annually, which in turn give their stores immunity from the virus. Also, the big box stores provide essential services, which need to remain available to the public during this deadly pandemic.
Follow up?
Right. Oh, okay. So like, what about LCBO stores? I guess they would be deemed essential during a deadly pandemic.
Well, the data suggests that certain alcoholic beverages are very essential ingredients in various cooking recipes.
Follow up?
It just seems like if this was as dangerous as you say, maybe the government should be prepared to shut down their own non-essential businesses as well during a province-wide lockdown, eh? Kind of sends a message that, maybe the virus isn't so bad. Or maybe some of the data could just be flawed.
What? Our data is not flawed. You're flawed.
Well, I just think that...
Silence! You fools were never asked to think. You are simply required to obey. You pitiful beings could not even begin to interpret our sacred scrolls of data. Do you really think you know what is best for yourselves and your families? Perhaps I shall dumb it down for you in song form. Oh, hello to all the peasants out there. I know you think these rules are not very fair, but I'm an elite, so you gotta listen to me, cause you're a dum-dum and I got the money. You were too stupid to interpret a holy site, so just shut your mouth. We want your compliance.
Well, I hope that's answered all your questions. I believe that's all the time we have.
Well, thank you, Doctor. Folks, I've said it before, and I'll say it again. I will always defer to the expertise of Dr. Williams. Remember, we're all in this together. May God bless the people of Ontario.